Thank you so much. Please take a seat.
You may be interested in learning how advanced technology will be used in your procedure. DePuy Synthes, a leader in orthopedics, offers the VELYS robotic-assisted solution designed for digital precision in knee replacement to help you start moving again. Let's take a closer look at how the technology works. The system includes a robotic-assisted device, a high-speed camera, optical trackers, and data screens designed to help surgeons achieve the highest possible precision level. With the VELYS robotic-assisted solution, surgeons are in control during the entire procedure. The device does not move or operate on its own. Your surgeon will start the procedure by making an incision in your knee. Next, they attach trackers to your knee, which work with the camera to gain the information needed to perform your procedure. From this information, the surgeon creates a 3D model of your knee. Your surgeon will move your leg back and forth to test the function of your knee. This will help assess your full leg alignment and soft tissue tension. During your procedure, your surgeon continually gathers data related to your knee to help them perform a precise knee replacement surgery personalized to your specific anatomy. This process helps your surgeon optimize the outcome with the use of data that's unique to you. Designed for precision, this advanced technology can help your surgeon visualize and predict the stability of your knee joint, find a favorable implant fit, and perform a highly accurate knee restoration. To restore your knee, the surgeon guides the robotic device to remove the damaged bone and cartilage in your knee, making sure it matches the surgical plan. The technology software is used to verify your final alignment and balance. The implant components are placed, and your surgeon will check the range of motion. Then your surgeon will remove the trackers and close the incision site. After the surgery is complete, your care team will work with you on developing a post-surgery recovery plan.
The system will start the registration process by acquiring the center of the hip. The medial and lateral malleoli are acquired, as well as the center of the tibia to compute the tibia mechanical axis. The medial and lateral tibial plateau references are then acquired to set resection height, before finally acquiring the tibial sagittal axis for a tibial rotational reference. Next, the patient's femur is registered, specifically the knee center, as well as the epicondyles and a patch on the distal and posterior femoral condyles. The system will extract the most distal points on the medial and lateral condyles, before finally acquiring the anterior cortex and the white side line to propose the femoral component, size, position, and orientation. On completion of the registration steps, the surgeon is prompted to finally check the acquired registration points prior to moving forward with the procedure. The bone resections and the AccuBalance graph can be modified using the ProAdjust planning screen, with single-page planning to help easily adjust parameters, so the surgeon can personalize alignment and balance relative to soft tissue. To modify the initial surgical plan and obtain the intended ligament tension, there are two major steps. The first step is to adjust the femoral component position to achieve parallel medial and lateral gaps. This is achieved by adjusting varus valgus orientation of the femoral component varus valgus to adjust the gaps in extension and adjusting femoral component internal-external rotation to change the gaps in flexion. The second step is to equalize the flexion and extension gaps by using a combination of adjustments. For example, adjusting the distal femoral resection level to increase or decrease the extension gap, or modifying femoral component size or AP position to increase or decrease the flexion gap. If you are following a patient-specific workflow, anatomical component positioning can be achieved by adjusting the varus valgus orientation of the tibial and femoral implants.
That is a quick have. Please come in and he will have all the details about the robot for you, and you can also have a Q&A. If you have any questions, you could ask him towards the end of his session.
Thank you, Hari. First of all, a warm welcome to all my senior colleagues, my mentors, our unit director, Mr. Surendra Prasad, Dr. Amol, and most of my beloved physiotherapists who are sitting at the back bench, the entire Johnson & Johnson deputy team who has arrived all the way from Pune and Bombay, and all the press members. As we all know, we have gathered basically today for the grand opening of our robotic system, which is from Johnson & Johnson company. This is called the DePuy Velis robotic system, and believe me or not, it is one of the most advanced robotic systems at the moment available in the entire world. Okay, there's a reason for this, because I normally started before that. Basically, I would just like to dwell for a short while into robotics. Robotics in joint replacement, basically knee and hip replacement, started way back in US somewhere in 2006. So initially the first robotic system came for a partial knee replacement. Partial is a small joint. Basically you only put in one part of the knee which is worn out. And then subsequently they realized they want to bring in something for a total hip, and so they got a system for a total hip replacement somewhere in 2011. Then by 2015 they thought of doing something with a knee replacement, and so they got something for a knee replacement. In India, the first robotic system was bought somewhere in Pune way back in 2017, which means we are still, India got robotic systems long time ago, and over a period of years finally it moved into the metro markets, and gradually the second and third tier cities started getting systems. I started my robotic journey way back in 2023, and the reason behind it is basically I on an average do around 150-200 replacements a year. I've been into private practice for the last 10 years, 10-12 years. So you can calculate the numbers. Roughly, I must have done about 1,500 plus replacement surgeries. In spite of that, in spite of doing all the meticulous preparation, you can still expect some patients who are not happy or not satisfied with surgery. And this number has been posted to about 20% across the world. And that's the reason the company started thinking into what can we do, how can we bring in more satisfaction in the patient level. So decades ago, the alignment philosophy was very simple. People wanted to place the implants at 90 degrees to an angle to a line which, if you draw from the hip to the knee to the ankle, the implant had to be placed at 90 degrees. And this was called the philosophy of mechanical alignment, which stood the test of time for the last 40 years. Dr. Deep Bhandari will second that. He's been he's evolved through this alignment philosophy. Over the last 15 years, what has happened is a lot of surgeons finally started with the US and then Europe. They thought basically why not place the implants and balance the ligaments, and that's the reason the philosophy of kinematic alignment came, and that's the reason robotic system was introduced. So over these years, basically a lot of robotic systems have evolved, and now we have got to these new robotic systems, which are the third generations and the fourth generations, which give you a lot of superiority over the previous robotic systems. I started robotic systems way back in 2023 when I trained on one particular robotic system. I would not name it, but I trained on one particular robotic system, and I had the privilege to get the robotic system to Manipal Hospital, Goa. We had the system over here for about 2 weeks. I did about 15 surgeries on that system. Subsequently, in December 2024, I got the same system and operated about another 7-8 patients, all of them fantastically well. This year, in the month of February, I got the same system parked in the hospital for about 7 days. I did about 6 surgeries on this system. And then in the month of May, I got another striker surgery system on which I performed about 4 surgeries. The reason was basically to understand what system you feel as a surgeon you would be comfortable with. So after doing all the systems, using all the systems, basically finally we came to the conclusion this is the system we wanted, and there are specific reasons. The most important reason for this particular system is this system has got a console, and this is the console, the main console, and the operating screen on which you do all your planning. It has got a robotic arm. Now most of the systems do have, and some systems do not have robotic arms. Robotic arm is very important because the robotic arm moves. You attach a saw to this system basically, and the whole thing moves. You've already seen how the robot moves. Now this robotic arm is very much detachable from here. You can detach the arm from here, which means the whole thing segregates, and finally you will have one small part of the robotic system which is attached to your operating table. So as a surgeon, when you're operating, you are standing here, your patient's knee is here, the arm is here, wide away from you. Whenever you want, you can bring the arm close by to you and you can put it back. Other systems, the problem is you have a big machine over here and a very big arm, you can barely see your knee when you're operating. So as a surgeon, the first thing you want to see is what you're cutting. It's literally very difficult with the other systems. You literally have to only look at the screens and keep on visualizing where you're cutting. This is not something very good for a surgeon. That's one of the factors why I thought this would be a very good system. Second, the implants. Johnson & Johnson implants, DePuy, have been the pioneers in joint replacement surgery. If you know Dr. Chittaranjan Ranawat, who became very famous basically because he operated on Vajpayee way back in 2001 when I was a student, and that's the reason replacement also became very famous in India. In fact, he was one of the pioneers of these Johnson & Johnson DePuy implants. These implants have stood the test of time for the last 50 years, and the latest implant which they have in the market for the last 10 years is one of the most implanted implants in the world, ATO knee. It comes in 2 or 3 different types, but ATO knee is one of the most implanted implants. So the second reason of going for this system was we also wanted to make sure our patients are going to get the best implants delivered, which has got a very good track record. That is also very important because you may have a beautiful system, but if you do not have a joint which doesn't match with the system, then you may not have those results. Those are very important. So a beautiful joint, a beautiful system, a beautiful joint. The third thing was versatility. With this system, you can literally, without doing any pre-op X-ray, CT scans, there is no need for any CT scans or MRIs with this system. You can just do a plain X-ray, a standing X-ray, and on the X-rays, you can just go ahead with the system and start your surgeries. All the planning is done on the basis of X-rays. Now, in the video, you have already seen how you do the planning. So basically, you take a few points here and there it's all a technical part, and then subsequently the machine develops a 3D image of the entire knee, and it tells you what size of the implant we're going to use. So a total knee replacement normally has got 2 parts, or 3 parts rather. The bed was the cushion. So it tells you what is the part of the femur, the top part, what is the size of the tibia. And then subsequently you have all the options on the system camera basically to balance something called a graph, so that eventually you have the best balanced knee in terms of ligament laxity. That's most important. If you have a very good balanced knee, no matter whether you do robotics or non-robotics, your patient is going to be very happy. And so it's very difficult, literally, when you have nothing in terms of a technology, for you to understand what balance have you received. It's very easy to say, okay, this is a fantastic knee, I feel it's very good. But when you put it up on the screen and then you get to see the numbers, then you get to the, oh my god, okay, this is where I'm losing out. Here it's opening, there it's not opening, here it's quite loose, here it's quite okay. So patients typically when they walk may not have any problem generally, but when they're climbing stairs or they're getting down down the stairs, or they're trying to get up from a commode seat and vice versa, or getting in and out of the car, that's when they're going to have a problem which is called mid-flexion laxity. Typically when you bend your knee, they may feel a little bit loosening feeling, or they may feel some sound is coming. So the sound is normal, but they may get the feeling of something giving way. And those things you can negate using this system, because here you can objectively determine what is the level of accuracy you can get. So we can determine up to 1 millimeter of accuracy, even 0.5 millimeters accuracy for that matter, and close to 1 degree of accuracy in terms of implant rotation. Right, so that's the level of expertise we can do, and then we can translate whatever we do on the computer screen onto the operating table. That is also very important. It's not just you plan then and everything happens over here. A surgeon has to use his brain. He has to have full understanding of his concepts when you do a surgery. So that is also very important. This is not a system wherein you just take the system and everything comes, then you go and finish a surgery. No, this doesn't happen this way. You have to use your brain, you have to use your acumen, you have to use your experience, and then make use of the system to ultimately deliver the best surgery you can offer to that particular patient. So that's the reason basically we decided to go for this system, and we've had this system for a while, and we have already operated on quite a few patients now. And I've had a wonderful time using this system. The best part of the system is it decreases your hospital stay. We now offer single day arthroplasty, which means if I'm doing a 1 knee replacement, or even for that matter a partial knee replacement, the patient doesn't have to stay longer. We admit them on the day of surgery, we operate them within a few hours, they walk within 3-4 hours of surgery, and they go home the very next day. Right, so that is the level of expertise which can be brought using this robotic system. Patient has very less pain. Typically, they recover very faster. They get their knee bendings very faster. They get knee extensions very faster. They have very minimal swelling as well. Now, all of this is an advantage because of robotic system. What happens in a robotic system is we don't release. No matter how deformed the legs are, the legs could be this way or the legs could be this way, because all the planning you are doing on the bone. And so it translates into a beautiful design of a surgery. And so you don't really have to do a lot of muscle release. So after surgery, they don't have a lot of swelling, and so they get faster recovery. This is also another big advantage because of which we thought of this particular system. So I would like to conclude that we are very happy and we're thrilled to have this robotic system And as of now, using this for total knee replacement. Subsequently, we have already got the software for a partial knee. Very soon, I think in the next 1 or 2 months, we probably will start with partial knee replacement as well. And we look forward, to delivering best results to our patients and at a fraction of a cost. So with this, I would like to conclude my talk on this robotics. If you have any questions, you are more than welcome to ask me.
If there are any questions, the forum is open. Anybody from the media or anybody would want to ask any questions to understand more, he's here to answer the questions.
Any of my physios can ask any questions.
Can I ask? You say you diagnose indication for this robotic assisted surgery when you are plain X-ray.
No, sir. What I'm saying is you can plan the surgery only on the visual X-ray. A lot of other systems require CT scan. So the thing is two advantages. One, I'm saving the cost of the patient because I'm not doing a pre-op CT scan. Secondly, I'm not giving unnecessary radiation to the patient as well in terms of a CT scan.
And this camera gives imaging what? Is any radiation there or it is purely a camera?
No, so the camera is basically because when we operate, we have to transfer the information from my knee, patient's knee, onto the camera. So we use temporary pointers and arrays, we call them, and that arrays aligned with the camera. So whatever movements I'm doing or whatever points I'm taking is being registered by the camera. And then ultimately all the information comes on the screen. So without camera, it's got infrared sensors. So without a camera, you cannot relay the information. That's the reason you have to have this camera. And it's a very sensitive camera, very sensitive. Some systems I've seen, you have to literally move around the camera. This picks up even small signal.
And you said it is dependent on surgeons. What is the learning curve?
So it will take time. See, I have been using this system for the last 1.5 years, so I have a fair amount of idea what people do. I have been also with Dr. Heiko Greichen, one of the authorities in Germany, and now he's in Switzerland as well. I've spent some time with him. With a lot of other people as well. So people have a fair amount of idea. So when you work with those people, you fine-tune yourself in terms of what you want to do. So alignment philosophy, as I rightly said before, was simple, mechanical alignment. You can still do that alignment on this. But there are 5 more different alignment philosophies which are there in the world, right from Japan all the way to US. So all those different philosophies you can offer, depending on how good you have trained yourself. And it's a very intuitive system, and it makes you think. It literally makes you think while you're operating. It makes you think, okay, fine, this side, on the inner side, I feel the knee is tight, outer side it is loose, what should I do? So you have 3-4 parameters which you can move on the system and then get back to the perfect balance.
What will be the time duration?
For
operation?
No, so normally time duration initially if you're learning curve is a little higher, then probably you will take a little longer time. Maybe 10-15 minutes more. But subsequently then as the team gets used to it, then I'm sure you'll operate in the same time frame. So normal, So there's normal surgery we try to finish in 1 hour's time, roughly. But in the main surgery you may finish in about 25-30 minutes. Maybe you may take 40 minutes initially. Subsequently you'll come back to the same time because everybody is tuned to it. Your brain also is tuned to it as to what is going to happen if I do this much millimeters of cut. That's a surgeon's job. We also perform, so the replacement depends on your fitness level. So my oldest patient 98 years old, my youngest patient 22 years old. What I mean to say is, if somebody requires surgery at that particular age, we have to first see his medical fitness. Whether he or she is young or old. If our medical fitness is good, which means our heart function is okay, kidneys, other parameters are alright, then we can take the patient at any age. Now, when we take the patient at any age, robo can be used for any age. Robo is only a helping hand to a surgeon. So there is no separate indication for a robotic surgery. Robotics is only for precision, to get the best out of that particular knee. But basically, we also do offer stitchless surgeries in patients who want stitchless surgeries. So basically, nowadays you get glue systems. It's like a gum basically which you use on the skin, for stitching of the skin and all. So those systems also have been offered at Manipur Hospital Goa for the last 1-2 years.
Any side effect for that?
No.
After doing the operation?
No, so any replacement basically, whether robotic or non-robotic, will have no side effects per se. It is about your recovery or no recovery. Now recovery, it's 2 parts. Depends on your surgeon, also depends on the patient efforts, which is physiotherapy as well. So everybody shares their responsibility, everybody does what they're supposed to do, and eventually you have a very good recovery. Around 15-20% extra is what we expect, because the robotic system is in growth, so definitely.
Without asking questions, a lot of information has been shared, is what I believe. And thank you so much for that, Dr. Rohan. So with that, we come to the end of this official ceremony. I'd like to request Dr. Shireen, our medical superintendent, to come up to propose the vote of thanks. Thank you so much, Dr. Shireen. With that, we come to the end of this program, and I'd like to request you all to please have the refreshments outside. And of course, there's more opportunity to interact. Dr. Rohan is here, and the team is all here from Manipal. Thank you so much for coming again, and we'd like to look forward for your support in future. Thank you.
I've seen from zero to what we are having now. And as you know, medical field is all the time evolving, and it's not easy to keep in pace with all technology all the time. We thank Manipal Hospital, Surendra and his team for making this available locally for the benefit of our patients. And I'm sure this Manipal is known for the advancement all the time, that will still go further on. And Rohan has done an excellent job of getting right down to the basics to now. And I'm sure it will go a long way for the benefit of the society here. Thank you.
Thank you, sir. Thank you, sir.
Good evening, everyone. On behalf of Manipal Hospitals, I extend my heartfelt gratitude to each and every one of you for joining us today here. With newer advancements and innovations in the healthcare, I'm so glad that we are being able to celebrate this milestone with all of you. First and foremost, I would like to thank the members of the press and media for your time, attention and constant support. A special thank you to our speaker, Dr. Desai, for sharing his insights today. Our organizing team and the amazing team of Johnson & Johnson, thank you for your seamless coordination and hard work in ensuring this event was executed successfully. And finally, to our brilliant doctors, your passion is what is constantly inspires us, this team, to grow and advance. We can't thank you enough for all the motivation that we derive from you. Thank you so much. Thank you all for being a part.